Hi, I am Dr. Manoj Mahajan, Director of Oncology Services, Department of Medical Oncology and Hematology in Pacific Medical College and Hospital, Udaipur, and I am also the founder of Cancer Care Clinic, Udaipur. So I am back with another episode, colorectal cancer. So to understand the colorectal cancer, we need to know what is colon and rectum. Colon is an inverted U-shaped tube just below the stomach. It connects rectum and small intestine. And rectum is a small part which expels the waste into the anus. So how does it function? Normally when we eat food, it is partially digested into the stomach, then it goes to small intestine where it is digested, and after that it enters into the large intestine, that is colon. So in colon, water and salt is absorbed from the remnants of food, and then it forms the waste products and it travels through the rectum and to the anus. So this is what the function of colon and rectum. How does a colorectal cancer start? As I explained, the colon and rectum are like the tubes. So inner linings of the tubes is normally replenished every 2 to 6th day, and they form new epithelium every week. So whenever there is a chance of regrowth, there are higher chances of getting cancer. So these epithelial cells in the inner lining of the colon form a polyp, which eventually turns out to be cancerous over a decade or so. So how does it spread? It usually spread through the adjoining vessels, adjoining lymphatics. It can spread to the nearest lymph node, it can spread to the liver, it can spread to the lungs. What are the causes for colorectal cancer? First and the foremost, obesity. Being overweight and obese is the biggest risk factor for having a colorectal cancer. So how do we calculate being overweight? It's very simple formula. Calculate your height in centimeters minus 100, whatever is remaining, that is your ideal weight, plus minus 2. Second, smoking is a big risk factor. Third, alcohol is again one of the risk factor for colorectal cancer. Fourth, lack of exercise. Having a sedentary lifestyle is a risk factor for the colorectal cancer. Fifth, diet. Increased intake of red meat and processed food leads to colorectal cancer. So we'll also talk about the preventive aspects. So going by the causes, the first is obesity. So to reduce your weight and have a normal weight as per the norms. Second, quit smoking or tobacco as soon as possible. Quit alcohol as early as possible. Fourth, diet. You need to increase your food intake with a lot of fresh vegetables, fruits, grains, and avoid or minimize intake of red and processed food. Fifth, exercise. Having a daily routine of 30 minutes per day for 5 days in a week is must, which will reduce the risk of colorectal cancer. So is there any way where we can find out colorectal cancer in the early stage? Yes, there is a way. We can go for a regular screening for all patients who are asymptomatic after the age of 50. So what are the common tests which are used? Commonly used tests are stool for occult blood, colonoscopy, sigmoidoscopy. These are the simple tests which can detect the cancer in very early stages or sometimes before it turns out to be cancerous. So as I have said, it starts from the polyp, which can be detected early, and it can be removed colonoscopically before it turns out to be cancerous. Friends, I hope you like this video. Please share with your loved ones. Stay tuned to learn more and live more. Please don't forget to subscribe the channel.